Hi, everyone. I just inhaled a ton of water through my nose, so feeling good. I'm very serious. It's all up in there. So I'm really happy to be a guest here on these Saanich and Esquimalt and Songhees territories. I'd also like to acknowledge the unceded Musqueam, Squamish, and Tsleil-Waututh territories where I live and where I've done my practicum. So I've been working with the Institute for Critical Research in Health and Healthcare Inequities, CRIHHI, good mouthful, which is a research unit within the UBC hospital. And we have been working in partnership with Crabtree Corner, which is a local resource center for pregnant and parenting women in the downtown east side. So my placement was within a study that was centralized around women in the downtown east side who are at an elevated risk of negative health outcomes in pregnancy and postpartum. So this was working with a population that commonly demonstrates an overrepresentation of social issues such as poverty, homelessness, experiences of trauma and violence, as well as a disproportionate number of Indigenous Canadians. So the study is to learn about the barriers to physical activity that are informed by these experiences and to explore how pregnant and parenting women can be supported to be physically active. So this research has been operating with two guiding philosophies. Firstly, Feminist Participatory Action Research, or FPAR, which brings feminist philosophies into community-based research with a strong highlight on gender inequity as a central source of social and health inequity. And secondly, we're guided by intersectionality theories, which acknowledge the multiple factors that shape a person's identity, and it looks at the unique experiences that are informed by these intersecting forms of oppression. So the main focus of our work has been expanding on the concept of trauma and violence-informed care to demonstrate how integrating trauma and violence-informed approaches into physical activity can help to address the barriers to participation experienced by marginalized women. And my case study has taken on the form of several key projects involving the gathering and interpreting of knowledge. Firstly, I undertook a literature review to explore existing trauma and violence-informed approaches. Oh no, Betty, don't do this to me. To explore existing trauma and violence-informed approaches to physical activity and to identify the gaps and limitations in the area. I worked to prepare a manuscript for publication in the Canadian Journal of Public Health, we hope. I supported community members in identifying and sharing their own knowledge of community resources, and I compiled this information to create a booklet detailing existing local physical activity resources that are accessible for women with histories of trauma and violence. And then using participatory approaches to knowledge development, I worked to create instructive toolkits and workshops to be used as training guides for physical activity organizations to contextualize the community and convey how organizations can contribute to creating accessible environments for women experiencing barriers to participation. So these were very fun to create. The values I found to be essential to bring into this work, fostering and supporting the equalizing of relationships between marginalized groups and community developers to help constructive knowledge and service development. Supporting community leadership has been really important to developing research that best illustrates the knowledge that's integral to understanding community issues. Creating fuller understandings of the contexts informing health and social inequity can aid understanding of the multiple marginalizing factors that impact health outcomes. Conducting a lit review really highlighted the need for greater prioritization of participatory research methods in order to improve the relevance and appropriateness of research outcomes. Cultivating the collective resources that participants and community partners bring to the table has been essential to developing new programming that the community will sustain independent of our involvement. And this was an exercise in connecting the theories of trauma and violence-informed practices and the ground level knowledge and experiences and perspectives of community members. And it involved navigating the differences in communication methods and knowledge interpretation between academic researchers and the community. So I've had a strong focus on using social determinants of health to contextualize barriers to positive health outcomes. And this has really fostered my interest and appreciation for intersectional philosophies and feminist participatory action research approaches. So thank you, everybody. Thank you to Francine Derrick, my supervisor, who started as an instructor for our qualitative and quantitative research methods course, and who now I am very happy to be developing a working relationship with. She has been my research Obi-Wan. I hope she's watching and just heard that. And then to Betty, the practicum coordinator, wizard, queen of the world, and Natalie, who has just been everywhere for everything through every step of the way, and everybody, and Jillian, and Michael, and Trevor, and yeah, all the PHSP folks who have been so helpful and supportive.
Thank you, that was an excellent presentation.
Thank you.
Very proud. Okay, one question for Cleo? Oh, sorry, I didn't see you.
I'm just curious when, so you're trying to promote physical activity with women who are pregnant or parenting, and when taking into consideration perhaps their marginalized or intersecting identities, do you have any information, or did your time there ever touch on the extra barriers that population might experience? Because I know I've worked with women who have intersecting identities and can be marginalized, and it can be really difficult to get them to focus on something secondary to them, like exercise,
Like physical activity?
when they're trying to just function sometimes.
Yeah. No, absolutely. The things that create barriers are so complex. I mean, we're looking at extreme poverty, and then also so much social alienation from physical activity, especially when we're talking about structured physical activity, is so commonly sort of a more affluent or more privileged thing to participate with. And there are a lot of alienating factors to that. And then there's also time poverty, and also the labor of poverty that is also complex. I shouldn't get into that, but that occupies most of your time, because being low income is incredibly hard work, and finding time for structured physical activity is, like you say, not a top priority for survival.
Great, thank you very much.